Today we're going to talk on liver cancer, and I'll be talking about it in 15 minutes. So it's a very brief overview, and I'll try to cover as much as I can. Firstly, this is purely an educational session. There is no conflicts of interest, and a lot of the pictures and all that are available on the internet. So again, please do not take this as a representation of a clinical consultation, and if you're unwell, please see your doctor. So I'll be focusing on these few topics, namely what is liver cancer and why is it a problem, and what are the causes of it. A brief history on the history of vaccination in Singapore for hepatitis B. Talk a bit about screening and how we as medical oncologists manage liver cancer. So liver cancer has consistently been in the top 10 incidents in Singapore. For males, it's actually number 4 in the list of the most common cancers by diagnosis and incidence. For females, it's outside of the top 10. But if you look at the slides on the table on the right, you can actually see that it is the 3rd most common cause of cancer deaths in males, as well as the 5th most common cause of cancer deaths in females. On average, consistently over the past 10 years, we see an average diagnosis about 2 liver cancer cases a day in Singapore. So the incidence of liver cancer increases with age, and the risk actually rises up significantly from the age of 40 years old. So for most patients at high risk of developing liver cancers, we do encourage screening to begin from the age of 35 to 40 years old, and to consistently follow up with the screening advice given by the doctors. So liver cancer almost always occurs in the background of liver cirrhosis. In layman terms, this is also known as hardening of the liver. The most common cause of liver cirrhosis in Singapore is hepatitis B, followed by other causes such as hepatitis C, alcohol, non-alcoholic fatty liver disease, also known as fatty liver, is emerging as a significant cause of liver cirrhosis, and the incidence is rising. This is not surprising because actually half of Singaporeans actually do have fatty liver if we actually do follow up and incidentally find it on scans. Hepatitis B vaccination only started formally in Singapore actually in the late 1980s. It actually started being compulsory in 1987 for all newborns then, which means that people under the age of 35 in Singapore are likely to have already been vaccinated, but that leaves a large significant proportion of people, especially males, unvaccinated. And so if they did not check or if they did not proactively seek out vaccinations, they will 1. Be unvaccinated, or 2. Be unaware that they are actually chronic carriers of hepatitis B. So what is hepatitis B? Hepatitis B is the most common cause of liver cirrhosis in Singapore, and as a result, the most common cause of liver cancer in Singapore. Up to 4% of Singaporeans are carriers of hepatitis B. Hepatitis B is transmitted by blood transfusions of contaminated blood, sexual, as well as being passed from mother to child, right, during the process of birth. Hepatitis B is not transmitted by eating contaminated cockles or char kway teow. All right, char kway teow with contaminated cockles will give you hepatitis A. Now, hepatitis A is like an acute viral infection. All right, it can cause inflammation of the liver, but patients recover from that most of the time, and it does not lead to chronic long-term liver inflammation and does not cause liver cirrhosis. So again, to clarify, eating cockles does not cause liver cancer. Eating cockles do not cause you to be carriers of hepatitis B. Yeah? Hepatitis C is the most common cause of liver cirrhosis in the Western world, but recently, over the past decade, hepatitis C can now be cured. The treatment is very well established. So patients with hepatitis C can seek out treatment, and 99% of the time they can be eradicated of the virus. So we hope that with time, the incidence of hepatitis C causing liver cancer will also slowly go down. So what do we do for patients who are chronic carriers of hepatitis B, or if they have liver cirrhosis from other causes as listed before? So we actually do encourage them to undergo screening, and screening involves a 6-monthly ultrasound of the liver, as well as blood tests, testing specifically for the liver function test, as well as a tumor marker also known as alpha-fetoprotein or AFP. There is no definite recommended age to start screening, but as you could see from our local data, the incidence of liver cancer increases from the age of 35 to 40, and therefore we do encourage patients at this age to begin screening. Females generally have an incidence that is slightly delayed from males, and so we actually encourage ladies who are chronic carriers as well to start screening about 5 to 10 years later than males. All in all, we encourage patients with known established chronic Hep B status to actually begin screening from the age of 30 to 35 or sometimes 35 to 40. So how do we identify or diagnose liver cancer? Liver cancer is one of those cancers that we do not absolutely need to actually put a needle, get tissue and examine it under a microscope. That's because liver cancers have a very, very characteristic appearance on scans. We do a special CT scan known as a triphasic scan, and liver cancers get most of their blood supply from the hepatic artery or liver artery, whereas the rest of the normal liver actually largely get their blood supply from a vein known as the portal vein. And so when we do a triphasic CT scan, the liver cancer nodule will become very bright faster than most of the liver, and by the time the other parts of the liver get their blood supply, the blood from the liver tumor would have already escaped the tumor and become darker. So with these special characteristics, we can actually diagnose many patients with liver cancer and also talk about treatment after without having to get a tissue diagnosis. Of course, whenever in doubt, we will discuss about biopsying the tumor for confirmation. So how do we treat liver cancer? Like most cancers, if the tumor is small, operable, surgery remains the best way of curing these patients. If the tumor is slightly bigger, if there are multiple nodules, for example, and if resection may not be easy, or if there are not enough what we call residual liver after resection, we do discuss other options such as transplantation. So surgery and transplantation remains the best way of curing these patients. If surgery or transplantation is not possible, then other means of controlling the tumor, and sometimes with very good results, include blocking the blood supply of the liver through a procedure called TACE, or ablating, such as heating the tumor up and burning them. If these methods, or these so-called invasive mechanical methods, are no longer available, that is where the medical oncologist comes in, and we talk about immunotherapy or giving medications to reduce the blood supply to the tumor. For many patients, unfortunately, if they are discovered in the terminal stage where their liver function is not good, or if the tumor is very extensive, we sometimes advise them for best supportive care or palliative care. So this slide actually shows that liver cancer is best not treated by a medical oncologist. So effectively, if the surgeons, the radiologists, and the gastroenterologists have already tried their best and say that, look, we can't do anything else, everybody looks to the medical oncologist to give immunotherapy or targeted treatment. So liver cancer is not just about managing the cancer, but also taking into consideration the underlying liver function. So we grade liver function as A, B, or C. By the time a patient has a liver function grade of C, survival prognosis is generally poor, and they may or may not be able to also take treatment that we offer. So if we diagnose a patient early and they do have good enough liver function, if they are in a group A or group B, or known as Charles A or Charles B, then we should still be able to control the disease, hopefully, for a long time to come. So why is liver cancer lethal? So unfortunately, cirrhosis is silent, and it involves and sometimes multiple lesions can also occur at the same time, and it actually involves the blood vessels very early, and many patients do not know until in the late stage, and therefore screening is very important. So one of the ways that we treat patients that are no longer surgically removable is that we actually do inject beads that block the blood supply directly into the liver. So the very same way that we can actually access heart arteries and do balloons to patients with narrowed heart arteries, we can actually also go to the blood vessels in the liver, inject beads that may also contain chemotherapy, all right, and other medications to block the tumor. Sometimes we actually do inject beads that contain the radiation, all right? And this is usually done if there are multiple tumors. But before we do this, we have to make sure that the radiation does not go to other places like the lung. Now, the emerging and newest type of treatment for liver cancer is immunotherapy. And this is actually to wake up the immune system to be able to identify the tumor, right? And the body is able to then get rid of it. So often at times tumor cells are able to grow undetected. It's because they are able to inactivate immune cells. So immunotherapy removes this inactivation, and hopefully the body is able to then start killing the liver cancer all over again. There are also many targeted therapies available, all right, and this is actually directed towards blood supply control of the liver, where we actually block blood vessel forming chemicals, all right, that the liver requires to grow. So this is a brief summary, all right, apart from immunotherapy and apart from all the targeted therapies that we have. In the past, in 10 years ago, for example, all right, this list that we have now was only made up of one medication known as sorafenib. But with more research, with more trials, this list is ever expanding, and we hope that patients can live longer even if they are diagnosed, all right, in the later stages when they are actually asked to be seen by the medical oncologist. So even though liver cancer is a bad diagnosis, but with more and more available medication, we hope that patients will lead meaningful lives with treatment. And with that, we've come to the end of the talk.